Just about to fly to Geneva and interview the director of the drug consumption room called K9. So very interesting trip ahead. Lucky to have Dr. Judith Yates with us and the lawyer Bill Jones. So exciting, Judith, we're here outside K9.
Yes, I'm delighted to be here in Geneva, and what a beautiful building, lovely colour. I'm hoping that tomorrow we'll meet with the directrice and hear how K9 has transformed the experience of people who inject drugs and are needy in the Geneva area. In Birmingham we know that we've been handing out needles and syringes to people for 25 years, being aware that many of them have nowhere safe or hygienic or clean to inject.
I love the fact that when they decided to build K9, they didn't go along the line, let's have somewhere inconspicuous, because you've got local businesses, there's blocks of flats, so there's residential area, and they could have put this drug consumption room in a hidden out the way, but far from it. They decided to erect it right here and decided to paint it bright green fluorescent color. If you look at the platform, there's 8 platforms at the train station. And obviously this building makes platform number 9, so hence the term K9, K being platform in French. Big open drug scenes back in the 80s. So as a result, well, let's put the drug consumption room where the problem is.
Ce qu'ils ont fait d'intelligence, c'est qu'ils ont placé ce bâtiment dans un endroit qui est toujours un endroit un peu difficile dans n'importe quelle ville, c'est-à-dire un endroit de passage. La gare.
Au Paquis, il y a des seringues à l'école des Paquis.
À l'école.
Oui, mais il n'y a pas qu'un neuf. Moi, j'ai jamais entendu quelque chose de négatif, mais
jamais.
Je sais pas.
Le fait que ce soit ouvertement visible comme ça, ça nous permet d'en parler avec les enfants. Voilà. C'est plutôt important.
Mais absolument,
voilà.
C'est de l'or.
À quoi ça sert, pourquoi ça existe, qu'est-ce que ça veut dire la drogue.
Ouais, à l'école, ici, à l'école des arts décoratifs, une fois, il y avait justement il y a des escaliers extérieurs pendant les classes, quelqu'un qui se piquait puis qui disait « je suis désolé, j'ai pas d'endroit ». Elle a dû se mettre à l'école devant les élèves et se piquer.
Oh là 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 là.
Mais c'était il y a longtemps, justement.
Ouais.
Il n'y avait pas d'endroit.
C'est ancien patron aussi, elle dit quand c'est ouverture qui est ici.
Ouais.
Les clients tous tranquilles parce qu'ils ont avant toujours arrivé ici les ranger les clients.
Oui, bien sûr.
Je pense que c'est une très bonne structure, c'est on va dire utilitaire, c'est simple.
Ouais.
Et donc voilà quoi, chacun. Je pense qu'à Genève il y a quand même un côté assez social et dont ça fait partie de je trouve cette politique.
The next morning, we were greeted by Martine, the director of K9, who introduced us to Rosie, a nurse who's worked there for over 10 years. Rosie began by talking about people's assumptions of drug consumption rooms and what they thought it would look like.
They imagine it's like a squat, you know. They imagine it's all dirty there's cans in the stairways and needles all over the floor and things like that. And then when they see the place, it's sparkling, new, and the furniture was new and everything was new. They were very surprised.
But what about the police?
We have a very good relationship.
It's a very free discussion.
Did the police just informally agree not to enforce the law, or was there actually a positive change in the law to permit this?
No. It's illegal to have some...
to consume.
Because here it's for the public health. Pour la raison de santé publique, c'est un conseil d'État qui valide ça. Et puis on fait des arrangements sur les zones. Ici, il y a du produit, mais les gens peuvent consommer pour des raisons de santé publique.
Bien sûr.
Maintenant, où on trouve des arrangements, c'est des modus vivendi, c'est des consensus entre le fait qu'il n'y ait pas trop de deals, il n'y ait pas de deal devant, que ça ne soit pas une scène ouverte, reconnue. On travaille avec les usagers.
In the literature in England, we talk about the necessity to have an accord between the stakeholders.
It's a formal accord, but not
up and down.
Official.
Not legal, not official, yes, but not pas au niveau des lois. Les lois, during the first 10 years, le procureur général était acquis au travail de la réduction des risques. On a beaucoup travaillé sur le fait de ne pas travailler en opposition police et réduction des risques. En 2003,
In 2003,
there was a new general procureur, and he said no tolerance.
No.
Et ça recommence, on a dû refaire tout un travail.
We had to start again all over
En fait,
again.
c'est l'échange, mais il y a quand même des bases de travail depuis 20 ans. Mais ça veut dire qu'il faut toujours rediscuter.
The efficacy of here,
Yeah.
Lausanne, at the University of Lausanne, and they could prove that what we were doing brought its fruit, you know. Also, the abscesses and the different sicknesses of the people who were suffering from that had gone down practically to nothing.
Of course.
At the hospital where I used to work there, they're gone from, I don't know, having 10 drug users in at a time down to practically never.
Like all drug consumption rooms, there are rules to using the premises. At K9, there's no dealing allowed or sharing of drugs, no passing of money between service users, no smoking of tobacco or cannabis. There's zero tolerance to violence, physical or verbal. You have to be over 18, although minors can still have access to needles and syringes to take away with them, and they will be helped to get access to service provision more appropriate for their age.
This is where we keep the chemist, you know, and the nurses, the doctor's stuff.
Yeah. So you have emergency resuscitation.
Yeah, we have, of course, oxygen.
You have oxygen, yeah.
They come in if their letter's been called. And they come to the desk here with a ticket. Yeah, one ticket's for sniffing, one ticket's for injecting, and the third ticket's for smoking. The local people, the neighbours, for example, have told us that since we've opened up the smoking room, that they have far less smokers up their alleyway, and they come in, they wash their hands. We have a ventilation here, whereas that is to suck up the smoke. If somebody sniffs, we give them this. For the injectors, I'll show you what we give them. Scorbit that's for the heroin. The spoon, there's a filter in there, a special filter, water.
When somebody overdoses here, you call the ambulance straight away if they're not reviving, they're not responding.
Yeah.
And then the ambulance comes, they've got some naloxone in the ambulance, and they will inject them and take them to hospital.
They get the guy going, and once the guy is looking a bit pink, they put him on the bed and they wheel him out to the ambulance and they take him to
for
hospital.
observation. And have you had any deaths at
Never.
all? No, good.
We're not allowed. We press here, and you hear you hear that?
Yeah.
That's in case of an overdose.
Oh, okay.
So if there's somebody overdosing, I do that, and my colleagues will come with the
resuscitation
bag and the telephone to see if I need
an ambulance.
Yeah. Because sometimes the person's not really needing the ambulance.
We relocated to the staff room upstairs to discuss the benefits of K9 and how K9 acts as a gateway to treatment.
You explained earlier that since this place opened, that the number of people going to A&E and going to the hospital casualty has fallen. But that's because you're doing more dressings here, or you're looking after people better?
It's because with the risk reduction we've done for the disinfection of the arms and how to inject.
They're getting less access.
But if people have got bronchitis or pneumonia, I mean, that's because they have bad living conditions. They don't eat correctly, they live in the street.
Smoking too much.
Smoking, and then they have to go to the hospispittal for that. I mean, the abscesses have dropped dramatically, the number of
There's
abscesses.
still a lot of ill health.
But the ill health is related to the way they live.
Yes, of course.
And the lack of vitamins, the lack of cleanliness, the lack of sleep, the lack of everything. You know?
So do you have a good relationship, you think, with the drug treatment doctors? The people
yes.
And if you see somebody you think would need to be in treatment very quickly because they're very vulnerable, you can get them an appointment.
Si un usager veut un traitement, il l'obtient quasiment dans les 24 heures. Treatment service has a big open hour, so it's easy to go on appointment.
And do you see, you have this 120, 150 visits, people coming here a day, do you see many people moving away from injecting and moving into treatment and doing well? And
But we see people, we don't know what happens to a lot of them.
No.
We have people that change from injecting into smoking or sniffing.
Yeah.
We do see that. We do see people that leave Geneva, and we don't see them anymore.
Yeah,
some
so
of
you
them
don't know how well they're doing.
Some of them die,
Yeah.
and some of them we see. You cross in the street further up, and they're
They
looking.
tell you they're doing well.
They're looking clean and they're looking fabulous, and so they've stopped.
Other than the doctor who comes twice a week, are there any other professional workers, like social workers, who come here?
We have
regularly on a
we
routine
have a
basis?
psychiatrist who comes.
Yeah.
We have people from other institutions like Entracte, which is a place to help people.
Social service.
Social services.
They have social social workers, and also they help people get into a cure, a rehab.
For detox and rehab.
Detox and rehab. I asked Loic, the duty drug worker that day, to take me through the procedure at Quai for a typical heroin injection. On entry, the service user is asked for these basic details, which can be aliases in order to remain anonymous. The service user is required to show they are in possession of the drug they are about to consume, and this prevents dealing from taking place on the premises, which is strictly forbidden. To start with, for basic hygiene purposes, service users are required to wash their hands. Chosen equipment, including tourniquets, is given. Staff can also assist with vein dilatation, vein selection, and offer safer injecting advice to help prevent complications which can be costly to individuals and society. These interventions, however, cannot be given to somebody injecting on the streets.
Viens ici per non andare qua, la colle.
Dans la rue, ouais.
Vieni qua bien per consommer qua, per c'è la siringue qua, c'è la tous police.
Ah ouais, il n'y a pas les flics qui te font chier et tout, t'es tranquille.
Tranquille, consommer et sortir tranquille.
Pourquoi tu viens dans cet endroit-là?
Parce que je trouve que dans cet endroit, c'est pas parce qu'il fait seulement chaud, mais c'est plutôt pour voir des gens, avoir du contact avec du personnel médical,
bien sûr,
qui peut soigner ou donner des conseils.
Et tu viens de temps souvent, et qu'est-ce que tu prends comme drogue, si ça ne dérange pas de dire?
J'injecte beaucoup de cocaïne, je fume beaucoup d'héroïne.
Ah, attends, c'est bizarre ça. D'accord, donc tu fumes ton héros. Tu te piques à la coque, mais tu fumes l'héros. Ah, ok. Et tu te fais combien de tirs par jour en moyenne?
10 à 12.
In the UK, in Birmingham, they take these needles and syringes and they inject underneath the canals and in the car parks. And we've got photographs of needle litter all over the city centre. Do you think we should have a place like Quai in Birmingham?
Absolutely, because you save many lives, you reduce hazards within the area, and you can keep people heads out of water. Yeah. The drug users I'm talking about, that they can reintegrate society eventually. I've met many people. I can't give you hundreds and the numbers, but I've met people that have been really hard drug users that actually, after a long process, have become citizens that are working, and that maybe are just consuming a little methadone before they go to work and a little when they come home at night. But they're no longer stealing. They're no longer injecting in the street. They're no longer injecting.
There you go. There you go. So it's a
that's
proof.
the result.
That's the result of
There
coming here.
Not everybody gets off it, but a lot of them do. But I can remember being in the old town and seeing some guy fixing a door, and I thought, his face seems familiar. And the guy's looking at me strangely, and I'm looking at him strangely, and eventually he said to me, you don't recognise me? And I said, no. I know you from somewhere, but I can't tell you where. And he said, yes. I used to come to Quai. And I said, did you? And he said, yes, I've stopped all that. Now I'm married and I've got 2 children.
How beautiful is that? How beautiful is that?
That happens, but it's not everyone.
But of course, but at least that happens, and I think that's crucial.
And even for the other people, they move a little distance along the way.
Exactly.
Just, as you say, they get their heads up a little bit and they get a bit more stable. And they've got a chance then to...
Giving back some dignity.
Yeah.
You don't have to inject in a car park or in a public toilet. You know, you don't have to, no, it's about giving dignity. I think it's beautiful. It's beautiful. That's why it starts. That's how recovery can start, getting some dignity back. After leaving Quai, Dr. Judy Fietz and I reflected on what we have learned.
We talked about meeting the residents. There seemed to be no downsides as far as they were concerned.
I was quite impressed with how cost-effective the drug consumption rooms can be.
It's part of their whole harm reduction programme in Geneva. And we know that around the world people have found ways to fund this part of the drug treatment service, for example by the proceeds of crime. They have excellent relationships with the police because the police can see K-Nerve is part of the solution to their problem as well as everybody else's. It is against the law to consume drugs, but for public health reasons it has been agreed that people can consume drugs on these premises.
After being open a few years, a new Procurator General wanted K9 to be closed down. However, they presented the evidence introducing needle litter, bloodborne viruses, overdose death, public nuisance, and they had to change their mind.
They have psychiatrists who come in, they have doctors come in twice a week, they have social workers who come in. Although they're accepting people in the place that they are when they come in to the doors of K9, they're always offering them ways along and ways through into treatment. It just reminds me that in Birmingham we have the drug treatment services. We can, when people come to us, we can help them. We've got the surround services, but we're missing this one piece of the pie.
Well, we have learned a lot from K9 and the Swiss system, and we're now on our way home. Birmingham is doing great things in regards to drug treatment. Waiting times are down, mutual aid groups have sprung up throughout our city. Yet, as Judith stated, we are missing a part of the pie, and an important part at that. Our most vulnerable are causing themselves and our communities great harm. This could be alleviated by a simple, humanistic, effective and pragmatic solution. The Swiss understood this a long time ago, 28 years ago to be precise. Isn't it time we offer our most vulnerable and effective and evidence-based solution? With a simple intervention like a drug consumption room, we can engage with them to firstly meet them where they're at, and secondly, we can start planting the seed of recovery and help them access our city's wider treatment options.